Welcome to Charge Passing training for physicians, mid-levels, and clinical staff. Before we start, I'm going to review some key points in regards to charge passing. The first extremely important point is that all charts must be pulled from the appointment schedule in EMR. If a provider attempts to sign off on the chart and it was not pulled from the appointment schedule, a yellow triangle and error message will appear in the sign-off window stating that this encounter cannot be billed electronically. If this happens, the provider must cancel out of the sign-off screen, go back to the appointment schedule, and double-click to pull the encounter from the schedule. The second point is in regards to documenting in the assessment and plan. All orders and procedures that you want to bill for must be ordered in the assessment and plan. All orders and CPT codes must reflect the actual provider or the ordered for provider on the order. The ordered for provider can be edited within each ordered code by right-clicking on the CPT code, selecting Edit, and changing the ordered for field so that it reflects the proper ordered for caregiver. This also may be defaulted to the appointment caregiver under caregiver customizations that we will review at a later time in the training. The final key point is that you must use valid diagnosis codes. All labs and procedures must be linked to a valid diagnosis code, and only system-delivered diagnosis codes should be used. If a SNOMED or a free text code was used, that code will pass to the PM system, but no diagnosis code will pass along with it. An error message will also appear during the sign-off. The billing status will need to be changed, or a different lab procedure with a valid diagnosis code will have to be chosen. Next, we will discuss documenting in the assessment and plan. For clinical staff documenting, an ordered for caregiver must be selected for each code. In order to do that, you can either select the procedure, right-click, and select Edit, then update the ordered for field in the procedure order screen. You'll notice that mine defaulted to the appointment provider because that's set up under my caregiver options, which we will discuss later on in the training. If this needs to be changed or is listed incorrectly, I can click on the drop-down and select the correct provider. For this case, I'll leave it as the appointment provider and click OK. It's important to verify that the provider is ordered for provider is listed correctly under each code. You'll notice that under my AST, my ordered for is blank, so I'll click on the drop-down and select Dr. Del Grippo, then click OK. For appointments that are not scheduled with a provider, such as immunizations or nurse visits, the ordered for caregiver will need to be changed. For providers that are documenting in the assessment and plan, if the provider is the only one ordering in the assessment and plan and signing off on their charts, no extra steps are required other than to make sure that everything is properly documented. And finally, it's critical to make sure that the diagnosis codes are listed in the order of priority. The primary reason for visit should be the first diagnosis code listed. Once that's finished, we're ready to proceed to the history and physical screen. However, there are some exceptions for mid-level chart reviews and sign-off. The first thing that we'll discuss is the billing level. At the bottom of the assessment and plan window, there is an option to select the billing level. For mid-levels, because the chart may need to be forwarded to the provider for review, selecting the billing level here will allow them to have that default when they come back through to sign off when the chart is sent back to them. To change the billing level, if the default is not correct, you would click on billing level and update the window here. For this purpose, I'm going to leave it as an office visit billable and leave my billing level as the site default. Once this is done, I can click OK, And the mid-level should always confirm that all orders are listed and are correct in the assessment and plan window and that the billing level is correct. Once they're finished, they can proceed to the history and physical screen and click on Submit to forward it to the provider for review. The physician will then review the chart and select Send Back to forward back to the mid-level to sign off on. The mid-level will then select Sign Off and submit the encounter for billing. When clicking on the Sign Off, the encounter type and the billing level will default to what was selected on the assessment and plan window. The physician should not review and sign off the chart. If the physician reviews and signs off the chart, it will create a duplicate encounter in the billing system. After reviewing the chart, the physician should always hit the Send Back button to return the encounter to the mid-level provider for sign-off. For the next piece, we will discuss the sign-off window options. It is important to not select Bill from the history and physical screen. This can lead to duplicate charges. It is important to ensure that you are selecting Sign Off. The Sign Off window will appear and the encounter type will be set to whatever the default is. In this case, we'll leave it as an office visit. The billing provider must be selected correctly as the provider. The billing level will default based on what was entered in the assessment and plan window or what the default is listed in the system. The site default is going to send a generic office visit code to the billing system of 9999X. If an office visit was performed, it's important to click on the drop-down and select the appropriate code from the drop-down list. In this case, I'm going to select a 99212. If I leave it as the default, that is an incorrect code and must be adjusted by the billing staff. It's important that the provider select the correct code during this phase. Use Billing 1 and Billing 2 to document to an E&M visits. If the patient was seen for a well visit and a sick visit at the same time, you would be able to select both of those using the same process as you did that I displayed in the Billing 1. If the patient has a preventative or physical type visit with a sick or chronic disease follow-up, the preventative or physical should be listed in Billing 1. Billing modifiers will be added by the billing staff and the posters and are not required at this stage. Review the billing details. Click on the dollar signs to toggle between green and gray. Gray means that it is not billable. If I want to make all of these billable, I would need to click on the dollar sign so that it shows up as green. If I'm not billing for the blood work, then I will leave them as gray. There are a few little carve-outs for different types of visits. For office visit, the encounter type is a billable encounter type must be chosen. Select the appropriate billing provider. For billing level 1, select the billing level that would have been chosen on the fee slip or the route slip. That would be the 99 code typically. For billing 2, select the second billing level if it applies. Under the billing details, green will be billed and gray will not be billed and can be toggled by clicking on the dollar sign or the dollar bill. For procedure-only visits, the encounter type you should select the procedure billable, which you can find by scrolling down through the encounter types. Select the appropriate billing provider, and for billing level 1, you will select 0 no E&M charge because it was a procedure-only visit. In the billing details window, you'll then make sure that the procedure that was performed has a green $sign and is listed as billable in order to bill for that procedure. For nurse visits, the encounter type should be billable visit based on the type of visit that it is. For example, if it's an allergy injection, I would select the allergy shot billable. For the billing provider, I will still select the billing provider, which is usually a physician. Under the billing level, I will still select no E&M charge. Under billing details, the injection should be marked as green so that it will actually be billable to the insurance. It is important to make sure that the ordered for provider is correct in the assessment and plan before signing off. Once you have selected all of the appropriate options, which I'm going to set these back, you will click on OK, and that will sign off on the chart. For training purposes, I'm going to cancel and not sign off on this just yet. For historical updates, phone encounters, and other non-billable visits, the encounter type would be listed as non-billable, the billing provider would be left blank, and the billing 1 level would be 0 no E&M charge. Review the screen before signing off, and no billing details are required for historical updates. For crisp follow-up calls, the encounter type should be entered as transition of care non-billable. The billing provider will once again be left blank. The billing level 1 will be 0 no E&M charge, and the billing details are not required for a transition of care visit. Once all of those have been completed and sign-off is completed, the clinical summary can be printed, and then the encounter will be sent over to the PM system for billing. Sign-off is what generates that charge to pass over into the PM system. This is one more reason why it is critical for providers to review their charts and sign off in a timely manner. The charges will not be billed until they are passed over to the PM system. For the next piece of the training, we will discuss the EMR user customizations. In order to update the customizations, under the actions on the right side of the screen, click on Menu and then select Caregiver Options. The caregiver options allow the users to customize views and options in specific places throughout the EMR. These settings are only changed for your user login and not for all users. The first thing that we'll discuss is the Billing Level Quick List. The Billing Level Quick List can be customized to allow the most frequently used billing levels to appear at the top of the billing level drop-down in the sign-off window. All billing levels will appear below the dotted line. The default billing level cannot be changed. In order to customize the Billing Level Quick List, select Under Lists, Quick Lists. Under Lists at the top, click on the drop-down and select Billing Levels. All of the billing levels will appear on the left. To customize your quick list, select the billing levels that you use frequently and move them to the right. These codes will then appear above the dotted line in the sign-off window under Billing Level. For the Encounter Type Quick List, click on the drop-down and select Encounter Types. You'll follow the same process that you would for the Billing Level Quick List. If you are a site nurse, you may want to select the Transition of Care so that that shows up at the top of your list. For providers, the most common will most likely be office visits, so you may want that to appear at the top of the list. Select it and then click the blue arrow to move it to the right side of the screen. For the default encounter type, you'll click on the Sign Off option under the General field, and this is where you can select your default encounter, the third box down. Under this one, I'm going to select Office Visit because that's the most common one that I would use. The default encounter type can be customized to allow the most frequently used encounter types to auto-populate in the sign-off window. All encounter types will be listed below the dotted line, as with the billing level and the encounter type. For the default ordered for caregiver, you'll click on the assessment and plan. At the bottom under General, you'll notice that there is an option for when placing medication lab and procedure orders, default the ordered for field to. At this time, we are recommending using the appointment caregiver because that is what would be the most commonly used option. You can also at this point set the default notify caregiver for labs and procedure orders. We also recommend that in these cases you would use the appointment caregiver. Other options can be set, but it's critical that if you choose one of the other options, such as preferred caregiver or a specific provider, that you check the ordered for and the notified provider on each individual order. Typically, using the appointment caregiver will flow through the proper information. Once you've completed making all of your changes, click OK, and then the changes will take effect. There are some new and improved assessment and plan workflows that we're now going to discuss. The first pertains to injectables. As you'll notice, I have a Kenalog injection listed under my assessment and plan. The new screen is called the Medication Administration screen. In order to access that, you can click on the pencil icon and the Medication Administration Procedure Order will appear. Select Ordered For unless the default has been selected to Appointment Caregiver. So you'll notice that my Ordered For and my Notify are both selected to the Appointment Caregiver. When I click on the ellipsis to the right of the medication name, I can then make additional changes to my medication. The lot number, expiration date, and other required information can be entered into this window. Then you can save and complete. It's important to remember that if instead of using 10 milligrams, in this case you did 20, you would need to make sure that you change the units to 2 so that it properly documents that it was 20 milligrams versus 10. And click on OK, and now my medication has been properly updated. The next item that we will discuss is immunizations. Immunizations can now be fully documented from the assessment and plan without having to go to the immunization module. Select the immunization and click on the pencil. The immunization procedure order screen will then appear. Once again, select the ordered for provider as well as the notified provider, and then click the ellipsis to select the proper medication information. The Immunization Record Properties window allows you to enter the lot number and other required information without ever having to leave the assessment and plan. Once all of the required fields have been completed, click on the Save and Complete button, and then you can also click on OK under the Immunization Procedure Order screen.